Good afternoon, everybody. Thank you for coming in today. First, I want to introduce our partners that we have here that are in attendance for this meeting. We have myself, probably don't know me, John Canosa, Director of Public Health at the Clinton County Health Department. I also have Aaron Strife over here, Director of Healthcare Services in our Clinton County Health Department. I also have Gary Douglas, President and Chief Executive Officer, North Country Chamber of Commerce. John Bernardi, Chief Executive Officer of the United Way of the Adirondack region. Dr. Mark Davey, District Superintendent, Champlain Valley Educational Services. Carrie Howard Canning, Chief Nursing Officer, University of Vermont CVPH Medical Center. Also in attendance are Chris Craig, Airport Director, Plattsburgh International Airport. Rochelle Gregory, Clinton County Mental Health and Addiction Services, and Clinton County Office for the Aging, Darlene Collins and Colleen Monty are also here. With that being said, I will give you a brief introduction anyway, have some good discussions with you, and then we'll basically have some discussions by all of our partners here. Our goal today is to provide information that will be useful to our residents as they try to navigate this period of time, staying home, on self-quarantines, business closures, and the somewhat limited resources that are available in these tough times. We will provide a brief update about Clinton County's status in terms of the number of cases, that being one case that we do have now, as well as current testing in process and what we anticipate to happen with testing in the near future. Then we will turn the podium over to several of our other public health partners, some of whom you may not have heard from prior. They have joined us today to talk about the services that they provide, the resources that their organizations are providing during this challenging time. I will now turn the floor over to Ms. Aaron Strife, Director of Healthcare Services, to provide an update on the COVID-19 in Clinton County. Thank you very much.
Good afternoon. I'm going to give a quick update on some numbers that we did release this morning in terms of current testing. To date, as of this morning, we had 44 total people who have been tested. 8 of those have come back negative so far. 1 came back positive, and the rest are still pending. We are checking every hour on the hour to make sure that we're getting our test results. So we're keeping as up to date with that as we possibly can. We have an additional 12 people at this time who are on quarantine, and the people who are on quarantine are either people who have been identified as close contacts of our confirmed case, or they are people who have traveled outside of the country to CDC countries of concern, and we are monitoring them for 14 days on their return to make sure they don't develop symptoms. I do want to say that everyone who we have asked to be on quarantine or on isolation has been incredibly cooperative, and we really appreciate that. On behalf of all of those people, I'd just like to say thank you. And I do have one more public service announcement that my director asked me to specifically mention, but for our own sake and our own mental well-being, while we do encourage people to stay informed using reliable news sources, take time to check in with yourself during the day, take a break from the news, do something enjoyable, and we all just need to make sure that we're taking care of our mental health right now, because this is an extremely difficult time for all of us. I'm going to just jump into some of the questions that were submitted on Facebook, and I'll be paraphrasing them, but I'd like to address these now while I'm standing here. So to clarify, the people who were identified as close contacts to our case patient have been called, and we are working with them directly. That was one of the questions. Without releasing specific information on that patient, because he still deserves a level of confidentiality, please know that we are doing everything in our power to make sure that we are identifying every last person who possibly could have come in contact with him during the time period that he would have been able to transmit, and we are following up with them directly. So, if you have not heard from us, please know that you have not been identified as being a close contact. If you feel that you have been exposed to COVID-19, and whether that is in our case patient or a person in another area of the state or elsewhere, the guidance we can offer is please self-quarantine for 14 days. If you develop symptoms, follow up with your healthcare provider. So another question has to do with the test. So the person in Clinton County who was positive is included in that test count that I just stated. As far as the shortage of test kits, this is not unique to CVPH. This is a national shortage. CVPH is doing their best to get a hold of additional swabs. We have put in multiple requests through Eric Day to the New York State Office of Emergency Management. We have not received any swabs from them to date. So, as of this morning, there were very few swabs available at CVPH. I know they're working hard, and I think that they'll probably comment on that when they stand here and talk to you directly, but that's an ongoing effort to procure additional swabs. Just running through some questions here. How do people with symptoms get tested exactly when there is a shortage of swabs? So right now, because there's a shortage, we have to use guidance from the New York State Department of Health on how to prioritize the people who are being tested. I can tell you that healthcare workers who are symptomatic are a priority because we do not want them working while they're sick and then potentially spreading COVID-19 if that was to be what they were infected with to other vulnerable patients. So healthcare workers are absolutely a priority for testing. The other people who are priorities for testing at this time are people who have very serious symptoms who need to be hospitalized. Again, we have few test kits. I can't even give you a number right now off the top of my head, but those are the people who we are really working to get tested, even in light of the shortage at the moment. And healthcare professionals who are identified as needing testing, can get tested now at CVPH. So we, the health department, are working closely with CVPH to identify who falls into that category. So there are also just some questions that are miscellaneous about people in the community and how they're going to go about their own day-to-day business. Some of these questions include, do I stay home? We're being told that we need to do social distancing, and we know that there are categories of the population, for example, older adults, specifically over 60 years of age, that we consider particularly high risk. So one question is from a person who lives in a household with that population, and she wants to know if she should go to work. The best guidance we can offer is if it's feasible for you to remain at home, do so. If it is not feasible financially, then maintain the social distancing and the rigorous hygiene. The hand washing is essential. Another question has to do with doctor's appointments. If you have to go to a doctor's appointment for, say, any other reason, our recommendation is that you work with that provider office so that when you get to the office, they can get you right into a room. That might mean you need to call them when you get to the parking lot, but work with that provider office to see how they want you to handle coming in for routine appointments. I can say that if you have a cough or a fever, I would not recommend that you just go into a provider office. Don't just walk into an office, call them ahead of time, and they will give you guidance on how they want to proceed. So another question here is on shopping. I do know that there are some stores, I believe Price Chopper and Dollar General, that have special hours for older adults. The extent to which we can all shop as far away from each other as possible. Maintaining that 6-foot distance from other people is important. That's just general guidance across the board. There are some stores that are open 24 hours. If it's possible for you to go in at different hours that are less likely to be as populated, by all means, please do so. Another question here has to do with travel to the Albany area, and we are asking everyone to stay home if they can possibly stay home, and to only leave their house if they absolutely have to. That means for work, that means for other medical appointments, that means to get food or other household supplies. But we would like people to stay home unless it's absolutely not possible for them to do so for whatever reason. Okay, I'm going to ask our next person to come up. Thank you, everybody.
We're going to have Carrie Howard Canning come up now and talk a little bit about CVPH specific subject matters. Just want to mention in my haste to run through the list of our many partners that we have here. I did miss Mr. Eric Day in the back over here and Mr. John Redden. Eric is with Emergency Services of Clinton County. John Redden, of course, with Clinton County Department of Social Services. Carrie.
Thank you for the opportunity to speak today and represent the hospital locally as we take care of one another. Everything we're doing right now is geared towards caring for our patients, the people that work in our organization, and how we take care of our community, and we recognize the importance of our role in doing so. At the same time, we are making careful and thoughtful decisions about what we're doing to spread the limit of COVID-19 because it's extremely important. Things are changing often, as everyone involved in this knows, hourly at times, so we're working through things as they evolve. I'd like to hit some high points: visitation, elective surgery, hospital operations, and then thank folks involved and then answer a few questions along the way. So visitation, if you've been in the facility or been looking at what we're doing either on our website or previous press releases, we are doing screening at the entrances, select entrances to our organization for everyone entering the facility. We did receive direction from New York State Department of Health today that we are to suspend all visitation. So that's an extremely important message to leave with today, that we are working through the process to put that in place, and by 9 p.m. tonight there will be no visitation at our organization except in medically necessary ways, which will be determined by our healthcare team. Difficult decision, hard place to be, but it's extremely important to prevent the spread of COVID-19. We do understand the role of family members being present with people that are in the hospital and how hard that is. So we don't want that to be the case, but at the same time, we need to prevent the spread of COVID-19. We would ask anyone in the hospital or family members that have individuals in the hospital to consider the use of technology, the telephone. If they have a phone or an iPad or a way to connect with technology, we would like to do that, and we're working through our resources to do the same thing to hopefully have that available to people. Elective surgeries, again, making very difficult decisions around this. We have a highly skilled team that is on call at all times, and we will absolutely be able to handle any emergency that comes our way, but we have made the decision to cancel and reschedule all non-essential surgeries, procedures, or appointments within offices. We know that may cause some hardship, so if there's something that needs to be worked out in detail, we certainly can do that on an individual basis, but we're working through that process with the people involved to put those things in place. Again, if there's emergencies, we'll be able to handle those. We have people on call as we always do, and from an emergency space, it's business as usual. From a hospital operations perspective, staffing levels remain strong. We do not have issues with staffing if anyone is concerned around that, and we have a strong plan in place to manage things as the situation evolves, and we're learning as we go and making changes, as others have said to me, pivoting as needed in order to make sure we're caring for one another. partnership from the community, we ask, as Aaron and others have said, and likely will say after me, we ask that you stay home. That's the best place to be at this point if you don't need medical care. We need the resources that we have to be in place to care for the people that need it at the facility. And if you don't need care right now, for instance, something is non-essential, we ask you to consider coming, and we want you to stay home. Social distancing, as Aaron has said also, is extremely important. So in the event that you do need to go out, that you're conscientious about distances in between people, and again, hand washing is the most important mechanism for making sure that you don't get sick and or carry something that would cause others to be sick in the spread of COVID-19. To answer some questions that came through, I'd like to answer specifically the question around, does the hospital have enough ventilators? We've heard that throughout the last week, and it's here again, and I'm sure that is on folks' minds. Can assure you we feel prepared. We have secured additional ventilators and BiPAPs already, and we continue to work with New York State to be sure what we need to take care of the community. So people should be assured that we feel prepared and we have what we need. Questions around testing, as Aaron already talked a little bit about. We do have a very limited supply currently, and we are utilizing it, as Aaron said, for patients that need hospitalization to assure we have testing available for those individuals, and specific healthcare workers, as was already discussed. We are working with New York State and other resources to secure additional test kits, and we do have things in place and hope to have additional test kits in the very near future. I think what I would like to do is close by saying thank you to everyone that is working at our organization. Thank you to the families that are making sacrifices for people to be at work at our organization. This has been a very trying time, and I can tell you our team is extremely dedicated to making sure that people have what they need, and they're in a space of no different than anyone else in this room or anywhere else in the community. Things are changing. There's a lot of uncertainty. There is fear associated with it, but we have what we need, and we're working together to make sure everyone in the community has what they need. Thank you.
Thank you, Carrie. Appreciate it. I'd like to now turn the floor over to some of our other partners, if I could. First, I would like to turn it over to Dr. Davey, Superintendent, Champlain Valley Educational Services, and then we'll go in order from there. Thank you, Dr. Davey. Appreciate it.
Thank you, Mr. Pinoza. Good afternoon. Mark Davey, CVES, BOCES, District Superintendent. We have three main points we'd like to share, and then we'll expand on them very briefly. First, our schools are physically closed. Second, we're providing and continuing to provide high-quality instruction to our students. And third, we are committed and are continuing to provide support to our students and our school community. First, our schools are physically closed at this time. That includes all 16 school districts in our BOCES. That includes over 14,000 students and all of our staff. Second, we are continuing to provide quality instruction. We understand that nothing at all can replace the importance and the quality of a teacher providing live instruction. However, with that said, our teachers, our staff throughout all of our schools are committed to providing quality and high quality instruction in new and innovative ways. And that's being done using online resources and other resources that are at our disposal. Our staff have been amazing and are continuing to work very closely with our students and our parents to provide this. Next, we want to also acknowledge that every school district has a plan to provide food to our students. This morning and today, thousands and thousands of meals were delivered and provided to students throughout Clinton County and in Essex County. And there is a plan that every school district has submitted through our office to the state to ensure that that happens and to put in place that can continue to happen. So commending our schools and our staff for doing that, and a plan to understand that we are providing a valuable service to our school community and our students. Next, we also want to acknowledge that our schools not only are committed to providing those other supports, but we're also committed to providing mental health supports to our students. And that's being done through a variety of supports through the social emotional needs, including our school psychologists, our social workers, and other staff that are working closely with all of our school community parents and all of our students. And lastly, we are committed to also working with our community daycare providers and our municipalities to put in place daycare plans and provide resources and support to be able to meet the needs of our community as this is evolving, so that we can assist in helping provide support to our emergency healthcare workers and our first responders. Thank you.
Thank you, Dr. Davey. I'd like to now have Mr. John Redden come up and talk a little bit about the County Department of Social Services.
Good afternoon, everybody. First, I'd just like to say that right now, the Clinton County Department, so all programs within the department are fully operational. We are taking applications for home energy assistance, food stamps, public assistance, Medicaid. We have waived all face-to-face requirements, so we are doing interviewing over the phone to reduce the number of folks coming in. Our child welfare system is fully operational right now. We are ensuring and investigating any reports of abuse or neglect of our most vulnerable population, our children. We do that 24 hours a day, 7 days a week, and we will continue to do that during this time. We are asking the public try to not come into the department. They can call our department at area code 518-565-3300, and we can direct them into the proper programming and hook them up with the folks they need to, so they do not need to come into the department. So we are, like I said, we do have plans. We're in constant contact with our state agencies and getting directions from them during this crisis. But our priorities are to ensure the health and safety of the citizens of Clinton County, and that's what we intend to do through this crisis. Thank you.
Thank you, John. I'd like to have Darlene Collins come up and give a few statements, if she could, from the Office for the Aging.
We just want to make sure that our older adults in our community are aware of what programs have been suspended and which items are still available for them. All the exercise programs and the congregate nutrition sites have shut down. The adult day program at third age has closed as of today. The tax preparation program, the AARP offered through the Senior Council, was ordered shut down by AARP until further notice. Our senior outreach program that is offered through JCEO, they are still available to help if you call them. They're trying to do everything possible, avoiding face-to-face interactions, so you may have the service delivered in a different manner, but they're still available to help. Our personal care program through our expanded in-home services for the elderly program is continuing operations at this time, so the aid service is still available. Our home delivered meal program is probably the one that people are asking about the most right now. We do have plans that are in place to continue operating that program. Right now that program has not stopped, and they're actually expanding to people who used to go to the congregate sites. They're expanding the capacity to serve those people through our home delivered meal program. And our office is available. We are avoiding face-to-face interactions as well, but our staff is available to assist via telephone and to continue to provide information and assistance and help people access the programs and services that they need during this time. We have noticed a dramatic drop in people who were attempting to come to our office, and we thank everybody for that. We do work with the most vulnerable population during this outbreak, and we are very thankful that they are taking it seriously and staying home and helping us to keep them protected. And we're working with our entire aging services network and our other community partners to keep it that way. So thank you.
Thank you, Darlene. I'd like to have Mr. Eric Day come up from County Emergency Services, say a few words.
Thank you, John. Eric Day, Clinton County Emergency Services. Good afternoon, everybody. Just take a moment to say that the County Emergency Operations Center is up and running. We are operating at this point in a supporting role with our health partners, the local health department, CVPH, and in fact, a lot of the medical offices as well, primarily trying to obtain resources as they are used up in our community. The county 911 center is functioning, is staffed, and is able to handle all calls. We're doing well with that. The one message we would have with regard to 911 is if you do not have a serious life-threatening illness or emergency, we would ask that you not call 911. It's been said that if you're feeling feverish, flu-like symptoms, shelter in place, contact your local, your primary care provider. Please do not call 911. We don't want to flood the system with those types of calls. If it's a life-threatening emergency, by all means, call 911. Other than that, the County Office of Emergency Services, we've been staying in close contact with our partners in the fire service community, the law enforcement community, and of course the EMS, emergency medical responders, to ensure that they are prepared, have the proper messaging, proper understanding, and PPE. So I can assure you that at this time those services are all up and running, fully functional, staffed, not feeling any major impacts from the event at this point. And lastly, I would say that one of the other groups that we partner with often and communicate with is our utility companies, power companies, telephones, so on and so forth. We maintain communication with those folks on a daily basis over the last couple of weeks and can report that those systems are sound and functional as well. So no concerns in that regard. And that's all I have today. Thank you.
Thank you, Eric. I'd like to now have Mr. Gary Douglas come up, say a few words if we could.
You all know me to be shy, but I'll see if I can say a few things.
There you go. There you go.
I think there are times like these, they come every once in a while, different in nature, but they have a broad and substantial impact on the business community that are when the business community needs its chamber most and needs its chamber to be at its best. And I can tell you I'm proud of my team. We have 7 key people at the chamber that are meeting every single morning now at 10 a.m., digesting updated information, designing what we're going to put out for that day, and scheduling programs for the coming weeks. We are on top of this, I think, as much as any chamber can be in terms of being ready to respond and be helpful to the regional business community. We are communicating on a daily basis with all 4,200 of our member employers and organizations across Clinton, Franklin, Essex, Hamilton, Northern Warren, and Akwesasne. We early on created a web page which is being massively visited at the chamber website at northcountrychamber.com, coronavirus information and resources. Anybody can go there. It's available to the public. Has extensive links and other information that is updated every single day. So it's a site to not only visit once, but perhaps visit on a daily basis. And then every single weekday at least, we are issuing at least one edition of our daily dose of information newsletter going out, being blasted to those more than 4,000 recipients in the region with updated information. Things that are happening at the border, things that are happening with public programs that may assist, new executive orders from the governor or the president, new forms of assistance to provide relief and support for our businesses. All of these things, updates and new information every single day going to that audience. We are in the process of posting, if it hasn't already happened, it will before the end of today. We'll start having all of those newsletters also on that web page. So if anybody wants to go back and visit previous editions of the newsletter, they can do so. Again, these newsletters are getting a huge percent in terms of being opened and used. We encourage the regional business community to pay attention to those. I think they'll find them. There's a lot of stuff coming into the inbox on this subject. It can start to be a blur after a while. But here in the region, for region-specific localized information, be sure and open those every day and scan it. And I guarantee there's not a business in this region that won't find at least one thing in that newsletter each day that isn't of value and interest to them. So we will continue to do that. The newsletters include best practices by our employers, things that various employers are doing. MTL Cool is in there today. Mold Right Plastics was in there yesterday. summarizing the things they're doing on their work site. We'll continue to post those sorts of things and would welcome stories from companies who'd like to be considered to be highlighted for the good work that they're doing on site at their places of employment. We think that's valuable in and of itself for companies and businesses to see what others are doing. We have launched and will continue to expand and massage and revise as things change a Spend Local campaign, as we announced last week. While it's becoming increasingly challenging as things are closed or things have limited operations, I'll put it this way: to the degree that all of us can do so, and all of us will have ways that we can do so, maximize your spending at local businesses. Help them get through this impact. One of the things that we posted yesterday after a phone survey to accumulate all of the information was a listing also on the website now of all of our restaurants to identify those that are still open for takeout service, as well as indicating if they also do deliveries. Go there, use those, take advantage, give them some business. It's also a great way to have some great food from some of our great restaurants locally that we can't visit and go for lunch or dinner, but we can stop and do takeout or have it delivered. We're going to be doing similarly for pharmacies, and we're looking at other categories of business that over the coming days we'll be posting similar kind of information on those businesses that are having special services or provisions, curbside pickup, etc. We're looking for those as well to let us know proactively if we haven't reached you in the business community and you want to be included. Let us know things that you may be doing to enhance access to your business, because we want people to do business locally during this period. We will be assisting going forward very actively and aggressively with getting all available information to the regional business community on all forms of assistance that will become available, that is available and will be becoming available over the coming days and weeks to assist businesses in dealing with the severe impacts that they're experiencing. We want to make sure they know what's available, understand it, and then we will assist in facilitating applications or follow-ups or phone calls or whatever it may take. We will be doing, for example, a series of webinars. Our members will be hearing about one on Friday on employment law matters, so employers know their responsibilities and also benefits that are available and support systems and new provisions related to sick leave, family leave, etc. We'll be doing that for the HR community and employer community on Friday. Next week, date not set yet, but we'll be doing a similar program with the U.S. Small Business Administration on their loan programs and available assistance. Once Congress completes, hopefully this week, action on the pending legislation there that will have refundable tax credits and some other forms of intended support available, we'll do another webinar. We'll also be posting these on our website, so if businesses didn't make the actual webinar, it'll be there for them to open and watch at their convenience afterwards. So there's going to be a lot of that. So any businesses out there that are wondering, what kind of assistance am I going to be able to get, watch those newsletters we're sending out, visit the Chamber website, take advantage of the webinars and other services that we will be very actively on a weekly basis engaging in starting this Friday, and then I expect on a weekly basis, including some of the same presenters who will come back with updates as new things fall into line, new circumstances arise. So we'll be doing that. Let me update you all on the border. The border is not closed. Please do not use the word closed at the border. It creates undue perceptions. The border is about to be subjected to severe limitations on U.S. and Canadian citizens traveling across the border, but it is not closing. We expect that both governments, the U.S. and Canadian governments, will jointly be making a detailed announcement about this action within the next 24 to 48 hours. In the meantime, we have been since 7 o'clock this morning extensively reaching out in Washington and to our Canadian friends to pose questions and provide input on details related to that action. I'm going to give you an example that relates to this topic and some of the previous speakers who have been up here. It would surprise most people in the North Country to realize how many Canadian nurses and doctors commute to work in the North Country every day, all the way from Watertown to Plattsburgh. I understand there are some 75 in the CVPH system, 50 in the Adirondack Health System. They're a vital part of our healthcare community. that needs to be considered essential travel. When the Quebec government last week issued an advisory, because all they can do is advise, they don't run the border, so they can't enforce anything. But they issued, before the Canadian government did what it's in the process of doing, issued an advisory. It told Quebecers, basically, thou shalt not cross the border, and if you do, when you come back, we advise you self-isolate for 14 days. Well, it provided no exceptions, it didn't talk about essential, and it created a huge amount of angst from nurses and others who weren't sure what to do. We got the Quebec government to follow up with some amendments to that clarified some of those categories and expressly said, oh no, we don't mean to include this advisory to commuting healthcare personnel and some other, and truckers and some other categories. This time we're trying to get ahead of it. We spoke this morning to Congresswoman Elise Stefanik. We spoke to Senator Schumer's office. I had a call from Senator Kirsten Gillibrand. All engaged in outreach in Washington and in Canada, and will continue to on some of these specifics ahead of the curve of the actual detailed announcement. I'm pleased to say that there now is an assurance from Homeland Security that when this thing is announced in the next day or two, it will explicitly exempt commuting healthcare personnel across the border. So that will allay fears and prevent any confusion or any misunderstandings. So I'm pleased with the work that we're doing in those kinds of ways and the engagement from our congresswomen and our senators in doing these things and staying on top of this. I have some emails to take a look at as soon as I get back to the office that are updates on all of this. The border will not be closed to trade and commercial activity. So for an area like ours, where our large and growing manufacturing community is especially cross-border in nature in terms of being sister companies of Quebec-based companies in many cases, in almost all cases having cross-border customers and supply chains, they would have a right to be very concerned if there was going to be any interruption in commercial activity. There will not be. And it makes sense if you think about it. A lone trucker picking up something in a loading dock in Montreal, dropping it in Plattsburgh and returning is having minimal, if any, personal interaction. And most of our companies, in fact, have implemented procedures that further minimize the necessity for incoming shipments and the truck drivers to actually interact with their personnel. So good news on that front in terms of the overall commercial activity continuing north and south over the border. The one thing that we just learned shortly before coming here is the governor's announcement a few hours ago of an intent to issue an executive order later today that will extend the 50% staffing aim that's been applied to government on private business. We are assured that there are going to be a number of categories that are duly exempted from that. We're waiting to see that. I'm getting tons of questions from our member employers. Gosh, you know, is this going to affect me? Because I don't really see how our operation can get to that level. We have posed a number of those situations and those questions to the governor's staff. While I was sitting here, I had an acknowledgement at least that they have heard us. Thank you for the input. We'll be back to you later. It's at least nice to know somebody opened the email and they at least have seen what we put in. It has been looked at and is being considered. One of the questions we've asked is, would you really impose that on manufacturing? I don't know of any of our manufacturers who aren't already doing this to the extent that they logically can. In terms of their offices and their support personnel, those functions where people can work off-site, can work from home. But for most of our manufacturers, there's a certain number of people that are needed on the assembly line for the product to come through and go out. You can't just reduce that by 50% or the product can't be produced. So we're posing those questions. We're getting answers. If the answers aren't clear, when the list comes out later today, we'll be engaging with the state tomorrow to look to clarify, or if need be, to look to pose some specific company situations to see if there can't be some exceptions or some variances in order to avoid undue impacts. I think that's it. We'll continue to send out those daily newsletters and to stay on top of this on behalf of the business community as intensively and constantly as we can.
Thank you very much, Gary. I'd like to have Mr. Bernardi, John Bernardi, come up from United Way. Thanks, John.
I'm nearly as shy as Gary Douglas, but I'll see if I... I'll see if I can come up with a few words. As others have said, these are extraordinary times that we're living through, but we're an extraordinary region. We're extraordinarily resilient as people in this region, and we will prevail. The message I'd like to convey above all is that we need prudence over panic. That's extremely important. We need prudence over panic. We need people to be considerate of other people and be responsible and follow public health guidelines and CDC guidelines and be responsible in that capacity, but also to be respectful of what our neighbors might need at this time and not necessarily buy or take more than you need, but be respectful of the people behind you in line or your neighbors next door. From a community impact standpoint, there's a couple of areas that our organization has been engaged in working with our partners across the region, government partners, school districts, Dr. Davy and his colleagues, and nonprofits. And the two areas that we're most focused on are food and childcare. And I'll start with food. We've been mobilizing a great many of partners across the region to ensure that we're going to be able to provide food and make sure that children and families have what they need throughout this duration of this crisis. The schools have been simply outstanding. What Dr. Davy and his colleagues have done, and Dale Bro in Franklin County and that group of superintendents is truly outstanding. He and I were on the phone together Sunday morning strategizing about some things, and they've really stepped up. The schools are doing an outstanding job with a very difficult situation, as Mark said, delivering food and making meals available to students and families within their district. We've also mobilized many food shelves across the region to make sure that they're fully stocked and prepared to handle an increased volume, and are working with Office for the Aging and other partners to ensure that our elderly folks are taken care of, and they're doing an outstanding job, Darlene and her colleagues. I'm confident that we're going to be able to prevail and endure this crisis from a food perspective. But again, I would encourage people to be mindful of their neighbors and their friends and their colleagues and people who are also needing to make sure that their needs are met. The other issue that is a somewhat challenging issue is around childcare, and Dr. Davy mentioned that. And similarly, we've engaged a number of partners from across the region to make sure that we can meet the increased demand for childcare, with priority given to essential medical staff and first responders. And we've been working with many groups, including the YMCA, the Child Care Council, the school districts, the hospital, even labor unions, 1199, who has been in touch with our office to try to come up with some creative strategies. And we're going to need to really be creative when it comes to meeting that demand. We've also been working with the governor's office and state legislators to see if we can put some temporary things in place that would change or loosen certain restrictions and regulations during these extraordinary times, while of course ensuring that children are well cared for. And we actually have some very creative and unique models that are being developed, and I think will be rolled out in the days ahead. I think we're days away from some very creative and unique models, and we know that the schools have made the facilities there available for childcare, and we're in the process of figuring out how we would go about staffing those facilities and what that might look like. And there are numerous other models. The YMCA is going to be rolling something out the next day or two that's very unique and creative, and focuses again on essential medical staff and first responders. That's where we need to start, and then we can build from there. We've also put together some resources to, want to comment about Eric Day's remark regarding 911. They're doing an outstanding job there, and they're well prepared to handle any emergency or life-threatening situation. For those situations that are not life-threatening, we would encourage people to utilize 211, which is an information and referral system for health and human service needs across the region. Again, if it's life-threatening, use 911. If it's not and you need information or a referral, use 211, which helps alleviate the burden on the 911 system. We've also put together, at the request of the school districts, a listing of community resources across the region, Clinton, Essex, Franklin, and Hamilton counties. And it's on the table over there by the door if you'd like to take one. And that breaks down certain service areas, food and basic needs, family needs, public health, and mental health and counseling. And we've identified the resources that are available for people to call. And 211, of course, is also a general gateway for people. So we're working hard. And I say we, I mean the entire region, all the partners that are here in this room and beyond as well. I've never seen a region come together the way we can, and I'm certain that we will prevail. And once again, I'll close with the same message I started with. We need prudence over panic, and I hope our friends and neighbors across the region will keep that in mind. Thank you.
Thank you, John. I'd like to have Chris Craig from the Plattsburgh International Airport come up. There's a few questions that were posed to us, and he can probably answer them.
Good afternoon. I guess I'll answer the questions by way of just making a brief statement. At this time, the airport still continues to operate under normal conditions. We have been in contact with the Public Health Department and our other local, state, and federal partners regarding the response to the COVID-19 outbreak. We communicate daily, if not hourly, as we receive guidance, and that guidance is reviewed and integrated into our plans. I know there was a couple questions about air travel specifically. One was specific to the airline industry. The airline industry is undergoing unprecedented changes right now, daily if not hourly. I've received several communications today just on the changes that have taken place today across the airline industry. Bringing that to the local level, at this time, the only airline that has contacted the airport, contacted me regarding changes to their schedule has been Allegiant. They notified me yesterday that 3 of their flights that they have scheduled in the April timeframe that were duplicate flights for service down to Orlando. They had 2 flights on 3 days during April that they've reduced that frequency down to 1 flight per day. United and Spirit continue to operate their schedules as normal. Again, that's this afternoon. Things have been changing, on an hourly, if not daily basis, so that could very well change. And as those changes occur, they will certainly be put out to the public. As far as passenger traffic, we have seen a decrease in passenger traffic, and it's people are making that decision whether to fly or not. If they don't need to fly, they're not flying. If they have to fly, they're taking the necessary precautions. as far as the social distancing, the washing of hands, covering the mouth, those things. And if they're sick, they're staying home. The airlines have not ceased operations. We have not closed the airport. Until or unless we're dictated to do so, the airport will remain open. As far as the 10-person rule, it's not, we have received no guidance on whether to implement that. From what my understanding is, it is a recommended. As far as in the airport, as most of you know, it's not practical to limit, because if you have folks flying out. But again, like I said, they are practicing those social distancing procedures or guidelines that have been recommended by CDC and the local public health officials. And again, like I said, the airline industry is going through tremendous change right now. And as things change, we'll certainly get that word out. As far as our passengers themselves, it's no secret that there's a lot of cross-border traffic. We get a lot of our passengers from north of the border, just like a lot of the other businesses in this community benefit from that cross-border traffic. We're getting updates. We've been in contact with the chamber and with the border regarding the changes to the crossings, the proposed changes or the upcoming changes to the border crossing, eliminating it to essential operations only or essential travel. As we get those updates, we'll post those on our website. I encourage folks that are flying to contact their airlines with questions about their upcoming flights, changes to their tickets, and any other questions they may have about their travel plans. They can also go out to the airport's website. We have a page out on the website dedicated to the COVID-19 virus. There's links to the airline websites, and the information available through those websites about your travel changes is also available on those websites. As far as our response plans at the airport themselves, as I previously discussed, the airport has an all hazards plan that covers a multitude of scenarios. One of those scenarios includes the response to a communicable disease outbreak. We have been reviewing that plan. We've been integrating guidance we've received from CDC public health officials. Earlier this week, we met with some of our local state and federal partners to go over that plan and update it in light of the ongoing outbreak. And we're doing what we can do at the airport. Cleaning is ongoing. Our cleaning staff has been they've ramped up their cleaning of high traffic areas. That is continuous and ongoing. And along those lines, the airlines also have guidelines regarding protocols regarding the cleaning of the aircraft. That's out there on the CDC website, and each of the airlines have their own protocols on that. Again, we're open as of the moment. We're open under normal operations. We're managed or staffed to operate currently, and we're continuing what we can do to support the public, the community, and ensure the safety and security of the traveling public. Thank you.
Thank you, Chris. I'd also like to have Rochelle Gregory with Clinton County Mental Health and Addiction Services come up. We had a couple of questions from Facebook that she would be perfect to answer.
Hello everyone, Rochelle Gregory, Director of Clinton County Mental Health and Addiction Services. Some of the comments on the Facebook page have been that people are scared, people suffering with behavioral health, including mental health and addiction services, need additional support. They need outreach, and because of that, Clinton County Mental Health and Addictions remains open 8:30 to 4:30, Monday through Friday. We are practicing social distancing. We have rooms that are very large where we can continue to talk to people in a safe space that's at least 6 feet apart. The county has done a wonderful job of disinfecting and reinforcing cleaning throughout the building at a regular schedule. And we are encouraging telephonic counseling services in the clinic. So we are calling our people, we are offering telephonic services, and for anyone that is struggling or needs assistance, we are here to support you, and you are not alone. You can call us at 518-565-4060. We have a prescriber on site Monday through Thursday, so all of our services remain in operation. Thank you.
Thank you, Rochelle. Before I turn it over to any questions you might have, I just want to say, first of all, thank you to all our partners, county agencies that came here to have a good discussion, not only with the press, but with the public. We appreciate all of you for attending and submitted questions from Facebook. While we appreciate the opportunity to respond directly to your concerns, we may not have always been able to today answer every question that we did receive, especially for those with individual specific circumstances. We hope that the information shared today provides guidance for you as you make decisions about yourselves and for your families. Finally, I'd like to thank our county residents very, very much for continuing to be resilient and supportive of one another. Our Clinton County Health Department nurses, as well as our health planning and promotion staff and other staff, are fielding calls both from the general public questions, as well as nursing calls. And all calls that we have received thus far over the last couple of weeks have been very easy to work with. People are pretty understanding of the situation, a little nervous, but they've been great to work with, and we very much appreciate that. So with that being said, does anybody have any questions that they wanted to pose, perhaps to some of our partners that we have here?
I guess I'm wondering, we know the one patient male in the 70s. Is there any other information you can provide on how many people were identified who have come into contact with him, and any other information you can provide? I do understand that you want to maintain that confidentiality.
The question was if additional information can be provided about the specifics of our case patient. And I can certainly understand why people want to know more details. Everyone wants to know, am I going to be personally affected by this? What did this look like in the community? This is extremely difficult for us to balance because we do need to respect confidentiality and balance that with safety to the public. So please know that we are confident that we are protecting the public to the extent that the public needs to be protected at this time. That said, not only in Clinton County, but across the nation and across the world, this is a concern. So rather than focus on our case patient here, I would just like to say, we know that COVID-19 is spreading. Do we have a lot of cases here that haven't been identified because of the testing situation? That's possible. I will say, I think that we've done a good job so far as a region of implementing the social distancing that we need to implement. Travel remains a concern. Travel domestically is still open. So that is why we are asking people, remain at home unless you absolutely cannot remain at home.
I have a question not specific to this patient, but say hypothetically someone in Clinton County is confirmed positive for COVID-19. Say they did travel through our airport or took a train here. Would some passengers who were maybe on that flight be notified that they were traveling with someone who?
So if there's a situation that involves travel, then the way that it is handled is the people who are traveling to other destinations are notified. So for example, if it's to another country, that would be notification that happens on a federal level. If it's to another state, that would happen state to state. If it's to another county, then those patients are identified and the New York State Department of Health notifies the other counties that would be involved.
Aaron, can you explain more the process of contact tracing?
So the question was, and I'm sorry I didn't repeat your question. The question was, can I explain more about the process of contact tracing? Contact tracing involves interviews. So we interview the people most immediately involved, And then we go from there as we identify potentially more people who may have come in contact in an ancillary way, if not a direct way. So it's us asking questions. We have trained public health nurses who do contact tracing routinely for all other notifiable diseases that come into us. So that includes diseases like pertussis or diseases like salmonella. So this is not a new concept for us, it's a new disease, but we have guidance on what the contact tracing parameters are from symptom onset, for example, and that's the procedure.
And has this been found to be an effective tool with those other diseases that you mentioned?
The question was, is contact tracing effective? And yes, that is why we do it in public health, and that's why it's been done for over 100 years now. It's been deemed very effective. That's how they stopped epidemics of typhoid, and there's a long-standing public health history of implementing these very basic measures, and I keep reiterating this. They sound basic, but they are so effective. So that is the contact tracing, that is the social distancing, and that is the hygiene measures, and these really work, and that's why we're asking everybody to implement them.
And I'm assuming that the people who came in contact with this person are among those that have been tested. How long does it take for the test to come back, if that is the case?
So,
and once that comes back, it's a domino effect, and all the people who come in contact with those people, if it turns positive for them, are now in another area.
I will say at this time, the contact tracing and the testing are evaluations that go hand in hand, but just because someone was deemed a close contact does not automatically mean they require a test. If they're not symptomatic, that test may come back negative and provide no useful information until the person later develops symptoms. So that's how we're operating at this time. Your other question, please repeat that for me.
Well, I'm saying, if I was a person and you came in close contact with me, and your test comes back positive, how long does it take for that test to come back? And then, obviously, if you become a person that could spread it also.
Correct. So right now the turnaround time on testing has been about a day. That test needs to get down to Albany Wadsworth Laboratory, and then we get the result from them. As far as additional tests coming back positive, yes, then we do contact tracing for each positive case. So additional people would be notified if they needed to be quarantined or followed up on. Any questions for any of our other partners?
In regards to the border, you said not to use the term closed. I mean, how would you describe the limitations and talk about it a little bit? I mean, we all saw the tweet this morning from Trump that said it is closed.
It's not closed. Closed, I mean nothing's going across it. It is not closed. It's clearly remaining open to one of the largest elements of travel back and forth across the border, which is commercial activity. So right away, this is the fourth busiest commercial crossing in the country between the U.S. and Canada here at Champlain, New York. And so that massive amount of activity will continue to go up and down this corridor. There will be substantial restrictions on non-essential travel in cars and by individuals crossing the border. Frankly, it's all, as I said in some interviews today, well, what impact is this going to have on Canadians coming to your area? I don't think it's going to have a lot of impact because the impact has already come. You just had to drive around Cornelia Street last Saturday, which was a beautiful Saturday day, and compare it to the weekend before. The Quebec plates were not on the street. I counted 12 on a day when, a quarter of the traffic would be Quebec plates. So really the public has already elected to cease cross-border travel substantially unless they need to do it. So in a sense, this is following what's already happening. So it isn't that this is going to cause the impact of loss of business. As long as we keep commercial activity going and keep essential travelers, those categories being able to cross, this isn't what's causing the diminishment of. You go up to Champlain now, you might be one or two cars going through. So it's already happening without this action.
What term would you use though, Gary? Would you say limited access?
limited access, restricted, essential only plus commercial. But the thing with closed is there are some people that will and can do activity across the border. It makes it sound like everything is shut down and customs is going home, and that's not. We don't want that extreme notion, because there are categories that can cross, and particularly for our business community, their commercial-related shipping activity continues.
Dr. Davy, with the school year being disrupted here for a month right now, I would think that maybe we're looking at a later finish to the school year. Obviously, these kids are missing a whole month worth of education, no matter how much homework they're doing. It's not the same thing as classrooms.
Sure. On behalf of our schools, and everyone who is most likely aware that our school superintendents worked very closely with our local health departments in both Clinton and Essex County, and I can't thank them enough for their support, as well as our county legislatures and the Board of Supervisors in Essex County. So in both cases, we came together, and at the governor's directive at that time, local governments, it was a local decision, and our 16 superintendents and our local governments came together and made a decision to close our schools until the 20th of April. The governor has since issued an executive order that said all schools in New York State are closed for 2 weeks. He has said that he will continue to expand beyond that. At this time, as I mentioned earlier, our staff, working with our superintendents and at their direction and with them, have created learning plans and models to have ongoing instruction. It doesn't replace actual instruction in school, and there have been ongoing discussions about, for example, 180-day waivers, which includes how the state reimburses school districts. There has been a waiver that's been put in place. However, the extension of the school year and how that applies has not been determined, and there has been guidance issued by the State Education Department, and it's my understanding the governor is aware of these implications as well, that in a state of emergency, which currently exists in both Essex County and Clinton County, that the typical regulations are waived or can be waived. So this is ongoing. I do have a message to our students, and because this is a new change, it's unprecedented. We've never experienced this before. This is not a snow day. This is a new way for our students to engage with our teachers, and our teachers have creative and are creating innovative ways, and they've been amazing to create new ways to connect with students, and are doing so at unprecedented rates. So we're optimistic that we can continue learning, and we do ask for our parents' support to help facilitate this learning. And our community agencies have been phenomenal as well, from the United Way and all of our communities, and our local governments and our volunteer organizations have also been stepping up. There's been volunteers, there's other ways to connect, but this is new, it's unprecedented, and we're going to continue to stay engaged with our students so that we can still continue to provide learning opportunities for our children, and so that this can continue. But to answer your question about extending the school year, that has not been determined at this time. Okay, thank you.
Thank you, Dr. Davy. Any other questions for any of us, any of our partners?
I believe this would be for Carrie. You said that the number of tests remaining are limited. Do you have a number? I wonder if knowing that number might help people realize what a precious commodity they are for their fields.
So the question was related to testing and the limited supply and what an exact number might be. So we do have an exact number. It was, as of yesterday afternoon, early this morning, in the 70s. And as I've said, we're using it for specific healthcare workers and for hospitalized patients. So that number changes as things evolve. And we're in the process of securing additional testing material in order to make sure we have what we need to take care of the community. As Aaron said previously, we are not unique at our organization. Across New York State, across the country, everyone is struggling with the same issues, and I believe New York State and other states are looking at how to make sure hospitals and public health departments have what they need. So that's where we are today. We're doing the best we can, and we will continue to work hard to make sure we have what we need for the community. Yes.
And I know that Eric Day, every day I talk to Eric, and the one thing that every day has in common is Eric Please find me more test kits, whatever it takes for the hospital. So he can speak about that. He's trying.
Actually, no, I'm coming up to the podium to say a brief word on behalf of County Administrator Mike Zerlo, who had to step out and go to a governor's conference call, actually. Michael asked me to mention that the county is currently working to be, and I think as of today or tomorrow, will be in compliance with the governor's mandate for 50% staff reduction. As you've heard from my coworkers at the county with the various departments, we're all still available. We're all still working. We're all still trying to provide all the services that we do on a daily basis with a reduced number of folks to be in compliance. So we simply ask patience and continue to seek out the help that you need. We're here, but in some cases it might take a little bit longer with half the staff. So that was all. Thank you.
Thank you, Eric. Any other questions? Well, thank you very much for attending. Thank you to the partners again. Appreciate it, everybody. Have a good afternoon.